Welcome to our last module on respiratory protection, where we discuss respirator care, cleaning, and storage. As always, we'd like to thank the following institutions and individuals. In this module, we'll focus on care, cleaning, and storage of reusable elastomeric respirators. Some of the slides in this presentation are very detailed, and feel free to pause the recording at any time to review the slides in more depth. We hope that by the end of this module, you'll be able to describe how to clean particulate filter cartridges, explain how often cleaning and disinfecting respirators is necessary, and list the steps for safely cleaning and disinfecting elastomeric respirators. Again, our focus will be on reusable elastomeric respirators with filters that are enclosed in cartridges as you see here. These cartridges allow for wipe-down cleaning so that the filters can be reused. Not all filters come in cartridges, but filters must be in cartridges to be cleaned and reusable. Healthcare facilities should not use other types of filters. The filters inside the cartridges must not become wet. Reusable respirators should be inspected for damage frequently. These are the steps needed. We will discuss both cleaning, which is the removal of dirt, and disinfection, the removal of pathogens. Here are some general cleaning principles. An organized approach to cleaning respirators at the end of a shift is recommended. Here, we compare the basic steps for cleaning the respirators after each patient encounter versus at the end of a healthcare worker's shift. Between patients, the respirator should be wiped down on the outside using cloth wrung in bleach solution and allowed to air dry. At the end of a shift, cleaning should be more thorough and cartridge filters should be removed. Again, particulate cartridge filters should be removed before the respirators are cleaned at the end of the shift. They can be wiped down with the cloth wrung in dilute bleach solution. Never let them soak in water, since this will damage the filter inside. We recommend cleaning the elastomeric respirators in a centralized location at the end of the shift. This is the list of equipment needed. If there are a number of respirators to be cleaned, consider having 2 people so that the first person washes, rinses, and places the respirator in dilute bleach solution. The second person takes the respirator from the dilute bleach solution and rinses and dries it with a clean pair of gloves using clean tongs. If only one person is cleaning, they will need to use clean gloves for these last steps for each respirator. Since there are over 20 steps for cleaning the respirators properly, it's important to understand the big picture. The detailed protocol is in your handout. Here are the major steps. Don PPE and remove the cartridges. Scrub the respirator gently in warm water and rinse. Use tongs to soak the respirator in dilute bleach for 2 minutes for COVID or 10 minutes for TB. The tongs are used to keep the respirator under the solution. Don new gloves, or have person 2 use a clean pair of tongs to remove respirators from the bleach solution and rinse. The first person removes the original pair of tongs at this point and uses them for the next respirator. Air dry in a clean, non-contaminated area. If you can use a sink with running water to rinse after cleaning and disinfection, you will only need 2 buckets. If you do not have running water, you will need 4 buckets. If you use the sink to rinse after cleaning, remember to wipe down the faucet handles. If the exposure is to tuberculosis, increase the concentration of bleach and the amount of time in the solution, as shown. Here is the detailed cleaning protocol. You can also follow along with the handout. First, place the biohazard bag with the contaminated respirator mask near your cleaning area. Then, place a towel and lay tongs on top. Place a second towel nearby. Prepare 4 buckets of fresh warm water, or 2 buckets of fresh warm water if there is running water available. Do not use boiling or hot water. Don PPE. Pour 30 cc's of dishwashing liquid in 1 bucket. In another bucket, pour 30 cc's of hypochlorite household bleach and mix with tongs. Remove the respirator and place it on top of the bag. Remove the filter cartridges by unscrewing or turning them to the left. Do not remove the valves because they are easy to lose. Wipe cartridge filters with cloth wrung from dilute bleach solution and place in the clean bin. Without removing the straps, immerse the mask in soapy water. Gently scrub the respirator only with a brush and soapy water on the inside of the mask to avoid damaging the valves. Do not brush eye lenses for full face piece respirators. Then, rinse in fresh, warm water. Running water is better than immersion if possible. Thorough rinsing is important to keep detergents or disinfectants from drying on the respirator. Discard the biohazard bag. Then, for disinfection, place the rinsed mask into the bleach disinfecting solution. Submerge the mask completely into the solution. Then, while the mask is submerged, use the tongs to turn the mask over until it is face down. Clip the mask with the tongs and leave submerged for 2 minutes. After the 2-minute immersion, either change gloves and remove the respirator with a fresh pair of tongs, or have the second person, also wearing full PPE, remove the respirator with a fresh pair of tongs. Then, rinse the mask completely. Thorough rinsing is important. Place on a clean towel and either dry with a clean cloth or allow it to air dry in a non-contaminated environment. Do not dry with heaters or in sunlight. When dry, reassemble the mask and filters. Check the integrity of the respirator and store in a plastic bag. Then, empty and rinse the buckets. Clean the sink area and wipe the faucet handles with the cloth wrung in dilute bleach solution. Finally, remove PPE and perform hand hygiene. After cleaning, respirators should be stored away from contaminated areas in a sealed container or bag. To summarize, cleaning and disinfecting respirators at the end of each use is needed to remove microbial agents. When cleaning respirators after shifts, PPE must be worn. The cartridges must be removed. Only the respirator is immersed and scrubbed in water. The respirator is disinfected with a bleach solution and then rinsed and dried. Here are some additional resources.